Okay, hello, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment. And this is the area of the meniscus that was torn on the MRI scan. You can almost see it already back here. I'm going to put a probe on it in just a minute. Right now we're just getting our initial look around the joint. The articular surface on the tibial plateau down below looks pretty good, as you see. And the femoral condyle up above also looks pretty good. Your knee was stable on exam, but we're going to look at that too, just to be complete. So we're going to remove a little bit of the ligamentum and the fat pad just so we can see a little bit better here. And that is what we're doing right here. So there's the anterior cruciate ligament. That looks pretty good there. Lateral meniscus is over here. We're going to look at that next. Okay, so here we are looking in the lateral compartment. And we can see there's a little loose piece of cartilage. You can remove that pretty easily with suction in just a minute here. We're going to put your knee up in a position that opens up this compartment a little bit more for us like that. And after doing that, we can see pretty well into this lateral compartment. The articular surfaces look good. And as we flush the knee, I don't see any other significant problems here, so that's good news. And again, that's the anterior cruciate ligament. So this is your patella, or your kneecap, at the top of the screen. So this is what we call the patellofemoral joint. We're just, again, using the shaver more to irrigate because it has suction attached to it. No significant injuries to the cartilage that we can see so far. And as we track down the front of the knee, everything's looking pretty good. We'll look over on the lateral side. That looks pretty good too. So we're going to go ahead now and go back to the medial side and probe the meniscus. We'll show you some more in just a minute. Okay, so we're probing this meniscus. It seems intact at the root over here. The area that I was most concerned about initially is in the posterior horn because that's where the MRI scan showed that undersurface tear. And we're just flushing out the knee for a second here. So as we come into the body and the anterior horn, this all looks good. It's almost where that dimple is that the meniscus is torn underneath, right about here. And that's what's pulling into the joint. We'll keep looking here, show you some more in a minute. So we've got our implant in with a horizontal stitch to take care of this undersurface tear here. And now we're just going to cut the suture, which is what we're showing you. Just making sure everything's snug. And then we cut the suture. And so that's our repair. That looks pretty good. I'm going to flush the knee out with a bunch of water here. And we'll put you through a range of motion. But that meniscus isn't buckling into the joint anymore. And that's through full extension and flexion. There's flexion. There's extension. So I think we're going to look around one more time, but I think we're pretty much done. And hopefully that'll do the trick for this meniscus that's been unstable. Luckily, your ligament on MRI and under anesthesia felt solid. So we're going to finish up here and get you back to the recovery room in just a few minutes, okay? Good luck to you now. Bye-bye.